Buenos días, bienvenidos a
Good
todos.
morning and welcome to each and every one of you. Thank you for being part of another edition of our webinars on Social Security. Today, the conference, the Inter-American Conference on Social Security and the Center is pleased to invite you to be a part of this webinar about social protection in the floors for senior citizens and the basic services for the elderly. From the Inter-American Conference on Social Security, on behalf and representing the chairwoman of this institute, Ms. Daisy Corrales, we welcome you all, expecting for this webinar to be one of the core activities for us to communicate how we can all improve when protecting our people when discussing Social Security matters. These are core subjects, and we welcome each of our keynote speakers. We thank you for participating. We thank you for your time. And with all our participants, without you, what would be the purpose on having webinars about Social Security? We're here working on developing that protection. Today, it's evident and clear that the subjects that we're going to be discussing these efforts lead us to improve the quality of life of our societies. We are going to be sharing our points of view. We can use the mechanisms on Social Security to protect the population, which is vulnerable, that's been affected, and it's faced the challenges amidst the pandemic. This improvement is what we're trying to achieve. That's why we open the floor today to the coordinator of this activity, the expert in the matter, Mr. Teran Paez. He is an expert, part of the Inter-American Conference of the Commission for the Elderly. He's hosted this webinar for Latin America and the region. By doing this, we want to share the best experiences and best practices and about this subject and other subjects on Social Security. Thank you, Mr. Diego. Thank you to all our audience, and thank you, Jorge. We thank all of those who are following us in Mexico and others who are based in other latitudes. The idea that we have as part of the webinar is to share everything that's correlated to the core subject, which is the analysis of the possible effects that the senior citizens face. We have to discuss the core subjects, and this is an ongoing debate. We're talking about the floors on Social Security protection in Latin America and the basic thresholds with the pension schemes. We're here today welcoming our panel members. Today we have a beautiful panel with Ms. Gabriela Mendizabal, Pablo Casali, and with Master Pablo Yañez. One of the elements that catalyzed the webinar of today is for us to open the floor to this dialogue, to listen to different stakeholders, the scholars, civil society, international stakeholders, to build our effort with this initiative to improve the quality of life of our elderly. I want to share a bit of the context. In the countries in the world, we're talking about out of 186, 97, 98% are part of the ILO, the International Labor Organization. So there's pension schemes in these countries. Out of these countries, 39% work with a system or a scheme of contributions, so 6% of non-contribution and 5% of these cases or countries have a hybrid scheme. We want to face reality. And when facing reality, we face everyday challenges, as it's been expressed by Dr. Ordeli. And amidst the pandemic, I'll say that that's a crucial challenge. We faced COVID-19. It's had an impact. Those who are at higher risk of vulnerability or mortality are the groups of the population in the segment of elderly, those who are over 60 years old. In the region, I'll tell you that specifically when analyzing what's happening in Latin America, there's different aging stages in our demographic samples of the country. In some countries, the demographics of the population and their age groups is different. So we have to go through these transitions. Our elderly, the number of elderly are growing in our demographics. So We have to start thinking now about how are we going to provide for the elderly universal access to benefits. Aging is something that's not just a process. In Latin America, when we speak about growing old, we correlate growing old to other processes correlated to circumstantial issues. So, as it's been mentioned, we know that there's a lack of equality in our region, even if we can talk about percentages in our countries. We know that our population might be a bit heterogeneous, and that's a determining factor. But we need to understand what the population goes through to draft our initiatives in public policy. Something that's an element or property in Latin America is that there's a high death rate. We as entities or bodies that are providing services focused on social security know that the workforce in a region leads some of the subjects to be unregulated, and some are regulated subjects. Those who are not regulated subjects don't have access to healthcare systems, or they don't have a guaranteed income or pension scheme. That's why we're a crucial body to try to incorporate those stakeholders that are not regulated subject and not part of the system, that don't have the guarantee to these human rights, which are, well, social security benefits. We know that part of the great challenges that we face now is the pandemic and COVID-19. Not This has affected not only health and our economics, and it's led us all to a crisis. Labor forces have been affected, and our societies have too. We have to say the following. We have the 2020 objectives. We have those objectives or goals to improve the life well-being of our populations. We don't want to leave any group of the population out of this effort. So the real percentages that we found in our regions after having analyzed them are positive. We have focused on the 2020 goals as part of our agenda. Unfortunately, we are facing a crisis that we have no president of, that generated that sanitary crisis, humanitarian crisis. So we're going to be simply working on this journey down this path, finding ways to protect our populations from the crisis, from the body, from this entity or our venue of the Conference of International or Inter-American Social Security. We have to double our efforts with the bodies that we represent. We have to follow the path to improve the services, knowing that Social Security is a universal right. And in essence, we can speak about effective coverage in the Americas. So that coverage in our region is one of the regions that surpasses certain numbers. It's 82.2% of our population in the Americas are over the age group. And some are part of the people that do receive a pension or not. There's a lack of fairness. There's also a gender gap. When we speak about gender beneficiaries of a pension scheme, whether they contribute or not to their pension scheme, we know that there's basic differences because of gender. There's traditional roles. The males are usually the ones that provide what they need to provide to their homes or households, and when they reach a retirement age, they continue, after retirement, they can receive whatever they saved during their working life. It's different when comparing males to females. And if we analyze what happened in previous decades, we know that women have had a tough time trying to access the labor force with a proper income. Women had been dedicating their life to simply giving birth to children and taking care of the household. We have to tackle or narrow the gaps, the gender inequality, and know that we have to work for those who are over a specific age group, so they could receive at some point pension when they reach a certain age. Our task with the ILO, we've worked together with this other entity to develop the floors in different countries to strengthen our efforts on social security. We want to synchronize and have harmony with the social programs that each member state has. We have to build those floors to guarantee a minimum income, a minimum pension to guarantee the well-being of our population, like access to health and other benefits that are part of Social Security. We must acknowledge that there's a lot of work to do. We know that we have to contribute. We have to contribute with a proper bedrock and build social well-being. We need to be capable of offering not just the minimum. We have the GDP, and 6% of the GDP is used to to provide. We know that there's asymmetry on social security matters, which is also a challenge. Not only is this all a challenge for public policy drafts, we want to tackle the barriers that exist. There's also budgeting challenges that we're facing. And from the Inter-American Center of Studies in Social Security, we've discussed in open debates to continue drilling down on these matters. And we're going to open the floor now for Ms. Gabriela Mendizabal. She comes from the Autonomous University of the State Entity of Morelos. Her presentation is called, it's called Senior Citizens as Subjects of Social Protection Floors in Latin America. She has a law degree thanks to the National Autonomous University. She's a professor and has a PhD in law from Vienna, Austria. And she has another accreditation from La Mancha, España, from this university. She's a researcher also from Social Security School and Law School, and works also with the Autonomous University in Morelos. She's a researcher and works with CONACYT in the second level, and she's also part of Max Plan for Social Rights and works with the German government. She's been working with collective initiatives and published different national and international papers. We welcome Ms. Gabriela Mendizabal. Thank you, ma'am. Thank you. Thank you very much. Thank you for being so kind and inviting me. I thank the chairwoman or leader, Ms. Dr. Daisy Corrales, and of course, Dr. Diego Teran de Cadam from CADAM. Thank you for sharing the webinar. We're working remotely, so thank you for allowing me to share my screen and my presentation for you. I created my slideshow to express the content easily. I briefly describe the floors on social protection for senior citizens in Latin America. The rest of the panel members will be introduced later on, and they'll be speaking about the region efforts. I will center my presentation on my subjects, and for the sake of time, I'll give you a brief context of senior citizens in Mexico. We're going to be speaking about the context of aging in Mexico, and we're going to also reach our conclusions and discuss some points as food for thought. Our question is, the structure of floors in Latin America are enough to provide a full coverage with a minimum income or basic or like renter income? So these subjects are extremely interesting. The first point is that I'm going to touch on is social protection floors in Latin America. So I know that these matters have been discussed in other forums. So the floors of Social Security find the reference in some treaties and conventions, the Philadelphia Convention, the Human Rights Declaration from 1944, the ILO regulations, and the agreement with the social pact. It's norm 102. That's the minimum insurance that all economies must give to their population. So the origin of this instrument dates back to 1952, ratified only by 48 of the member states. And this is due to the low level of coverage that we faced on social security matters back then. As Dr. Toran mentioned, the groups that are mostly affected are vulnerable groups in our society because of gender issues in the case of women and the elderly. they're affected, the unregulated subjects, part of the workforce, and other vulnerable groups are mentioned. So based on the following, I'll say that there is recommendations that the ILO submitted, the WHO did too, and the United Nations mentioned that we should all foster the access to services of different vulnerable groups throughout the whole lifespan, trying to tackle the conditions that make them vulnerable. That's why we have the fundamentals, the principles that guarantee. In the first yellow square, you find benefits for the elderly or senior citizens. There's the group with people who have different capacities or the disabled. Then in that segment, you find that these groups might be in poverty levels. The Social Security floors, those floors were drafted with guidelines or laws and regulations that are submitted as just recommendations. It's not like a soft law or positive law or law in effect. The country should design and frame the floors for Social Security with characteristics that comply with their institutional bylaws, laws and regulations, their economic situation as member states, and the objectives of each member state, which must achieve this as part of the reality. You know, these floors are the subject that we must think of. We know that the norm 202 states the following, and they established like a checklist, like a questionnaire to go through an assessment process. In Mexico, we have an entity called Coneval that evaluates social programs. They have a method to assess them, to rank them, but to rank them, the programs that lead us to develop our social security protections for our populations leads me to mention the principle of no discrimination. The benefits that are given by social programs in Mexico, I mean, not only Mexico, many countries have these programs. So this is a principle, no discrimination. The person the person that's the beneficiary must present their ID. And with that ID, well, you might be discriminating people who are just immigrants and don't have an identification or don't have a pass to access the country. They don't have their unique identifiers. There's even elderly that don't have documents, that don't even have a birth certificate. So people who are extremely vulnerable, that have extreme poverty to face, can't have access sometimes to these programs. Another principle that catches my attention is the progressive execution of terms and conditions. I've analyzed national programs in different countries, but I'll say this. In Mexico, we need to have clarity of social programs. We need to know what their objectives are. We not only have to fight poverty of a specific segment of the population, we need to work in this initiative so in the near future, and with or without the programs, our population have to be in another circumstance, in a different circumstance. They should not be in a circumstance of poverty. So whether they're regulated or unregulated subjects, we have to think about what happens with our people when they're part of the workforce. Our vulnerable groups have objectives, terms to comply with, and they should be capable of growing and achieving the use of benefits on Social Security. I want to talk about top quality services that are part of our Social Security institutes. The benefits that we provide with the social assistance programs usually have a specific quality, and their budgeting is tripartite. So the programs are created in such a way that to be a beneficiary of top-level health services or a broader coverage or a higher pension scheme or other levels are themes that are still not achieved. We have to be efficient when budgeting our resources, and this is key. It's not just, we don't have to just have a a box in which people should input their complaints. We need to be capable of having the beneficiary use the benefits that we offer without having to go to an attorney. For example, in Colombia, there's tutelage. There's documents that we have to populate and send it to the Caja Popular, that's the Social Security entity. We have a mechanism in Mexico that's injunction. An injunction is it's an instrument that you take to court to achieve the protection versus the organ or the courts. So in Mexico, we have specific executive reports that date back to 2020. These reports were submitted by the Mexican government stating that we have 82 million beneficiaries of Social Security and 49 beneficiaries of the Ministry of Social Security. We have a roster or a log of beneficiaries. We know that many people that receive benefits from Social Security also receive other Social Security in the first floor of the services. We have a group of elderly or a group of seniors that have access to private or public healthcare services. They're members of Social Security programs and they are compatible. So we have some programs that would benefit our elderly. When we speak about the pension schemes, there's a pension for the well-being of our seniors. And through health, we have the other institute for health and wellness and well-being, giving our population certain coverage. There's the minimum floor. Then that minimum floor is part of the network that gives our population support so they can have access and we can guarantee their access to their social benefits. I want to mention what happens with our elderly, the population in Mexico that's aging. I want to talk about it with you. In the case of our seniors in Mexico, the population is of 129 million. Out of these, 17 million or 17.5 million are senior citizens. In the past decade, there's an increment in this number. In people in our population who are 60 and over are 9.1% and 12% now by 2020. And in the age in our population, there's an age group from 0 to 17, and the percentages are there. We have an aging population clearly, and there's a rate. We have to measure, go through like an analysis to understand what's happening with the aging population, with our seniors. And we need to know what's happening with their schemes, pension schemes, and their incomes. In Mexico, we have a system of pillars. Those columns are columns that we use to explain what happens with Social Security in Mexico. That's like column 1. And then the second one, it's Social Security provided to the population. It's okay, it's the first column is there, and then we had to draft an initiative that's law, and it's part of the Constitution, so it's mandatory for government to provide these benefits. What happens with basic needs? What I can see here is that we must understand that the aging population they need healthcare services, and economic stability, and something that's not being mentioned is the programs of the floors of Social Security that we should provide to all the population as members or elements that could have access to the services. First point, with the aging population, we know that aging is a process. There's situations or consequences when we age, and we have to, build that path to that in our youth. If our elderly are living in poverty, we have to think about the situations that lead us to this. There's chronic health conditions that because of the lack of regulations, or if these subjects were not regulated, they didn't contribute to create the saving for their pension scheme. They're in that minimum threshold, and they're only in a survival level. In poverty in Mexico, that was a subject that we analyzed back in 2020 in Coneval. 41.1% of our seniors are in a situation of poverty. even food safety. They're in suffering famine. There's over 939,000 people over 65 that are living in poverty. They're receiving a pension because of the aging population they're part of, but they're not going to leave the poverty status just with a pension that they receive as basic assistance from entities working for Social Security. As I told you last year, there was an amendment in Article 4th of our Constitution. The state went through an amendment of the 4th article. The state finds it mandatory to give a pension in the terms specified in the provisions of law by law that's guaranteed for our senior citizens. That during that year, there was an amendment to the General Act of the Social Security Institute in Mexico. Not only in Mexico, but in Latin America, there's these type of efforts. The IMSS in Mexico is the entity or body that provides the fullest coverage in its scope. Whether you can think of it as positive or negative, it impacts our population. There was an increment in the contributions only for the employers. There was a decline in the numbers in which our beneficiaries have to work for like over 1,000 weeks, and there's going to be a pro rata formula and expression being applied to see the economics. These changes will benefit the seniors of our country. We should discuss the floors, the financial thresholds, the economic coverage. I know that these topics are part of debate. There's this law, and this law gives you the right when it's something that we have in our provisions. We have to think about the rights of our elderly. They have the basic access to a fee. It's vital for them to have access to our elderly. It's an economic benefit for those people who don't have other types of income, but there's people that have a minimum income, and sometimes we can't ensure the minimum life level that we require. So we have to ensure that we work to dignify our elderly, providing them housing, education, and also nutrition. We have to develop our elderly. It's extremely important. It's a human right.
And actually, what we're doing, we are talking about universal rights, and we know that this is a monthly transfer that we have. Usually, this is limited to 2 requirements. We need to be residents of a geographic area, and we do have a very specific age, regardless of the social, economic, and financial age, so that we can meet the needs of our daily lives. But this entails just giving everyone the same amount. So I believe that what we need to do is to also start to really trying to ensure the minimum fundamental basis. And I do not mean to be discriminatory, but what we're trying to seek here is equality to meet the needs of those who need or are in more need. This is what we need to do for a person to be able to live. And I can tell you that pension for the elderly is paid on a bi-monthly basis. It's about $66. That's what we're paying on a daily basis. No, not on a daily basis, on a monthly basis. While the line of poverty establishes and provides for that on the field, we require 2,203 pesos. That's $109, just for you to have an idea. And for the elderly, in the urban area, we require 3,333, which is $166 a month. As you can tell, this universal basic rent that we have for the elderly, it's not universally because it's not for the whole population. This is something that we established for the elderly, those who are over 68 or 65 years old, depending on whether they are in an indigenous community or not. That is not going to address the minimum income that we need to exit poverty. In case of healthcare, all countries have most expense in terms of health in the elderly. Mexico is no exception to this. The population of elders is about 12% or a little more. And that by 2050, this is going to reach 22%. And whenever we are in this population, we are going to be from 37 to 47% of the total expense in healthcare in the elderly. This is a concern because this leads us to feel that most of the population is taking up about 50% of the resources. And this has led to a lot of discussions in different times. And maybe 10 years ago in Germany, we could tell that, well, we needed to know until what extent we needed to ensure health of the elderly. These are persons who are not going to be just being part of these health systems in addition to the promise that we were going to have according to the costs of the use of the current technology. Of course, these discussions got to the point of confirming that we need to pay taxes, we need to also just get this income from Social Security in the best possibilities when we require these processes and not as funded when possible, when that workers started to contribute or pay taxes. In this case, the second point that I would like to address today, the third item, my apologies, are assistential care. We sometimes forget that once we are elders, we lose our autonomy, we become more dependent on others, whether because our intellectual capacities are lowered or our health is somehow detrimented or our physical capacities are somehow lessened, we require further care. There are very few countries that have a basis that provides care through social security. Usually we have assistential healthcare or even social beneficency or public or private services, but not as provided for the Constitution as in the case of pensions. This is not protected by laws as in the case of
No significa nada más darle una píldora a la persona o empujar la silla de ruedas, sino significa darle
a
asistencia.
wheelchair. It means providing assistance depending on this capacity reduction. These are the most recent data that we have for Mexico for 2019. As you may tell here, we know that we have carers for dependent elders. We also have a large number of persons with no carers with a small or severe, a mild or severe dependence. So talking about this basic rent, what we need to do is that we need to have this equality with a minimum vital income, and this needs to include the protection that they require whenever we need to have a carer. So I would like to tell you very briefly before we wrap it up, I would like to share an example. In this case, we have the German example. In Germany, we have an example to protect. We have this point of care. We have another area of insurance such as maternity, work risks, and we need to estimate that, well, dependence could occur at any point in life, maybe for someone who has this permanent disability or temporary disability but over a very long period. And well, we know that women have the role of not only being a mother, but also care and adults. Also, we have these persons with disabilities. We have people with disabilities and diseases. These are expenses that we know that governments cannot have whenever we do not have specific payments, whenever we cannot do this from the Social Security directly from this type of Social Security assistance. And what really gets my attention is this forecast by 2050. They estimate that they are going to have this general population increase. They're going to have this increase in the recipients of those care services. And the question here is, what are we doing? What is Latin America doing? We had the chance of just reading a book that we got on a study on Cuba. This is the crisis of care services for the elderly. We know that Cuba is a country in Latin America that has become older, and they're currently in a crisis. We know that the youngest ones go out to work, and they are, let's say, the main income of the family. Therefore, they cannot provide for this care for the elderly. Plus, it is very expensive. Everyone knows that a lot of Latin American women who are hired in Europe to look after children or the elderly, they have other types of income, but we have the whole scaffolding, of course, for this care in this, let's say, daycare institutions. However, we do not have any type of care for the elderly. So to answer to your question, if we know that the social protection offers enough coverage, I would say no, because we do not have a minimum vital income. And secondly, because we are not really considering the care that is required by the elderly, and specifically for those who are in a situation of poverty, because if they do have the means and if they can afford it, they can pay for a private area or for a private type of care. So this is something that gets worsened with poverty. Another thing is that we need to have this type of dissemination and awareness on the rights that we have in social protection for the elderly. We need to make these assistential programs legally enforced. We do not have that in our country. We need to have social programs organized, the social, let's say, minimum amounts according to the actual needs of the elders. We know that we have different situations. Someone who could, I don't know, live up to 100 years and they could be physically and intellectually and mentally independent, or someone may get to 60 years old and being totally dependent. So the conclusion is that we do need administrative and financial planning for us to be able to have this social security basis for a vertical coverage. I know that there is a growth that is going to be more horizontal, but we know that next year we're going to turn 10 years after we started establishing this social basis. So we also need to strengthen our international instruments on social security, because nowadays with globalization, we know that people moves around more easily, and it's very sad to see that Mexico has not yet ratified this multilateral agreement on social security established by the Ibero-American Association of Social Security. And this should be key because we are protecting the elders in terms of benefits for their elder stage. And also we know that this also leads to this, well, the fact that you need to be a formal worker for you to be able to become a social security beneficiary. And also they would not reach, let's say, all of these benefits. We are all paying taxes, and somehow we are also doing this. We are providing a tripartite fee. We're doing that as a third part. So we know that those of us who are just providing this assistance, we're also funding this with our own consumption, regardless of whether we are formal workers or not. And I would like to just thank you for your kind attention. I'm here for your questions. And well, I would like to thank you for your kind attention. Thank you so much, Dr. Gabriela. Your presentation was very interesting. It really just somehow gives us the outlook of the everything that we have addressed with social security. So now regarding the works that we are developing as part of the commissions that we have here in CS and here in the conference, we were just addressing this situation where we know that we are really just going downwards. We see a lot of families that do not have the same number of children, or as we know that elders usually have to rely on their children. So beyond that, we need to go to this, let's say, point where we know that there is no really, we may become elders with no children, and somehow we are going to require care as well. So we need to think about this social protection for us to be able to ensure this. So I absolutely agree with what you were saying many times. It's what's behind those numbers. We have, let's say, 60-70% of the elders, let's say, satisfied, at least in terms of the fact that they have some sort of income, but it's not the minimum income. But the main issue here is that we need to recognize all of the inequalities that we find inside a country. We know that we have regions with variations. It's not the same thing being in an urban area with family areas. So accordingly, I feel that this also brings about a very interesting proposal, and hopefully for the audience, then we're going to be able to do many more things. So I would like to thank you, doctor, and why don't we just wait for other questions? So now let's get into Pablo Casali's presentation. He's going to have this presentation on pensions and the economic security of senior citizens in the face of an increasingly uncertain future. Dr. Pablo Casali got a degree in economic sciences, and he has a master's degree in social security. He also conducted a lot of activities in Sweden, Spain, and Italy. His areas of specialty are social security, health, and pensions. He has worked in Colombia, Peru, Ecuador, Bolivia, Argentina, Brazil, Bolivia, and Paraguay, and he has made contributions to other countries of Latin America. He also has different publications. He is the co-author of the Strategy of Social Security of the ILO, the role of social protection floor, and he is the co-author and manager of this labor overlook. What is the outlook for the present and the future for Latin America and the Caribbean? Since 2018, mid-2018, he is the expert of the social security of the ILO for the Andean countries, Bolivia, Ecuador, Peru, and Venezuela. He served in 2015 to 2018 as an expert in social security and social development of ILO for the South Cone countries in Latin America, in Santiago, Chile, and in 2010, 2015, he's the expert in social security based in Lima, Peru. Previously, he was responsible for social security in the International Training Center of ILO in Turin, Italy. So thank you so much for your kind participation. Welcome, Dr. Pablo. Thank you so much. Thank you so much for this introduction. It's such an honor for ILO and for me personally. So I would like to address and discuss the social protection. I would like to thank the ILO office particularly. Thank you so much for inviting us, for having us here. It's a very brief presentation. We're going to have debates and presentations, and well, we're going to have different concerns that we may have specifically related to this intervention. This is going to be very brief on what we're going to be addressing. This is going to be very interesting for debate as well and for this discussion matters. Basically, ILO has a deep work in terms of international labor standards. ILO is the only UN agency with this tripartite characteristic. We have different government representatives, we have employers and employees, and basically, well, they are employees, government employees, and they're the ones who decide in terms of this institutionalization and agreements, all of this legal framework for social security protection, and also for the advocacy of labor. All of these are based on the principle that social security is a fundamental right, but also social security is an economic need, it is a social need. It is very difficult to understand, let's say, the umbrella of all of this legal framework without really understanding that social security is a human right and it has to do with the need of having a minimum degree of this social protection that is also really promoted by the ILO recommendation, specifically on social security in order to ensure an appropriate distribution of income. It is also a financial need, it is a social need, an economic need, as whenever we have the different social protection programs, we have productive improvement as well. We have a very important driver to transition to this formal economy. I mean specifically 204 recommendation. as for this informal economy towards a formal economy, we are in a crisis just like the one that we're living right now. This is how we're strengthening this capacity. And lastly, as a social need, why? Because we know that, well, we have different levels of poverty, and then we have social capital as well, and we also have this type of situation, and all of this is as discussed. What are the main objectives of a pension system, social pension particularly? The main role of this social security has to do with also ensuring this minimum income. We have social services that need to be provided that could allow all members in a society, in this case in particular senior citizens, to have a social protection. And also we need to ensure all of this just based on what we have as part of the traditional social security services. We need to have the need of really having this power or purchase and procurement power, and we need to also be able to just be able to face any sort of challenges by means of this social assistance, just like with this crisis that we're facing right now. Now, for us to be able to address these social security issues based on a perspective that we have, well, according to this slide, we know that systems are based and built upon on our a per capita social security basis. We know that we have universal protection or through a combination of each and every one of these possibilities. Later on, we're going to see that once we address these issues and this guidance according to 202 recommendation, well, we know that this is a principle that could be enforced in all countries. And this is a third principle that is also accepted according to Social Security. Once we need to structure or build the social security, or, well, in addition to the cases that we need to address. What are the challenges of the social protection system? Well, we have the main purposes of these pension systems. On the one hand, we have quantitative coverage. How can we expand this progressively, this coverage for the elderly? But it's not just a matter of just moving ahead in terms of the implementation of these programs that could allow us to give this coverage. But as we start just progressing in this route map, what kind of services need to be offered, and also this 102 convention and also recommendation 2 on social protection, we see reference to this appropriate social benefits. And this is also related to coverage, quantitative coverage, and also that services and benefits are appropriate. It has to do with what we have to do with the systems. And we need to think of a wide coverage system with very generous coverage if that system is not sustainable in the long run, for instance. So we know that the three objectives that we have are related to what we are addressing, and all of this is key, and we need to take them into account whenever we need to just work with systems for us to be able to really have this broad coverage. This is not a simple endeavor because we know that social prevention systems sometimes, I like to tell you that this social prevention system are based on, let's say, the music that is played in the performance of the labor market. So we have some conditionals related to performance in this type of systems. We have some factors in the environment and other structural matters that are important as for what we have to do with the labor structure, and also this informality and the increasing informality. We know that although having women and their participation, we know that the impact of COVID in this labor force, then we know that this is a subject that we had progressing, not really taking huge leaps, but we had significant progress. And also the demographic change, we have this source based on our labor force. All of this is going to be somehow diminished, and this is also going to address the significance of thinking of this productivity as well. So how or how do we understand this life expectancy, and what kind of natural changes we have for these pension funds as well, for healthcare systems as well. And we need to somehow have this situation specifically under the regulations of a public fund that we have under the consideration of what we have to do. So now we know that labor force has to do with this growth. This is based on a very dynamic dimensional perspective. It is also true that the participation of women is lower than men, and this makes pension fund systems somehow having this systems, at least we see the need of having this type of coverage as well, and we also have this other circumstances. Lastly, I would like to talk about the scope of pensions before we get into the policies. So we're going to have these other two slides. This is the what would happens in the world globally. And also we can start just really addressing everything that we have as part of the countries in our region. This information comes from the latest World Report on Social Protection. We do this globally. We have this publication every 2 years by the social department of the ILO, and this is the report that also represents the policy in 2017 to 2019. And this is something that we're going to have in September. This is part of our global overlooks. As you may see in this slide, we have different appreciations driven by different points, let's say in terms of coverage and many more things that we have to do and say. We have very significant, let's say, progress in Europe as well, in this region in Latin America and the Caribbean. This is a region just like Africa or Asia and some other countries from this region such as Central America. And we know that performance is lower than the mean, both regionally and globally. Globally speaking, 67, almost 68% of the elders have some sort of income, a pension, or non-contributive policy income, for instance. Therefore, we know that globally we have had a lot of progress, and we have had significant progress just overall. We mainly see as well, we know that in certain regions we have more progress, and there are many more particularities depending on the region. And now I would like to introduce the situation and what is going on in the sub-region or the countries in that sub-region. We have countries with elders over 65 years old. Let's say I could talk about Argentina, we could talk about Brazil, Chile, other countries from the South Cone, except for Paraguay, because they have a lower number. And then we see the means and average for every sub-region. We have the Andean countries, 21%, Central America, we have about 18%, 18.3% precisely. And now if we add the whole region up, only in 43, 44% of the elders over 65 years old have some sort of coverage or financial security. We can later address whether if that income is appropriate or not, but well, at least they have some sort of income from Social Security. And if we add this to the elders, then we also see that we have these pensions, but also this is related to what we do as part of labor. Sometimes this is not appropriate, and then these persons need to somehow leave the labor market. They need to sometimes leave the informal labor market. So we are getting up to, let's say, 50% overall. That's the overall number. We know that we have more persons that are going to get into that place. And now the persons who do not get any type of income, whether from work or from a pension, this is according to our the statistics, we have about 34%, and then the remaining number is for persons over 65 years old who do not have any sort of source of income whatsoever. And well, this is what has to do with this formal relationship, and well, this is what we call as informal market as well.
The final thoughts as of now to talk about what's happened with our elderly leads me to speak about some data as reference. I want to talk to you about what's happened in the last 10, 15 years. There's been a lot of efforts from different economies and nations to modify the pension system, trying to precisely to change the coverage. When I talk about broadening the coverage, there's, reforms, amendments to broaden quantitative coverage to improve the sufficiency or adjustment of the schemes. Back in the 80s and 90s, we fixed or we listened to the population. We wanted to improve the quantitative benefits and, the social demand that surged in 2020 led us to understand that there was progress when improving the coverage. There was the demand of the services we needed to provide the adequate, sufficient benefits. There's statistics that lead us to understand the growth of the programs that you can see, correlating it to coverage of the pension schemes and the services there. What we determined based on graphs on the stats at the corner of the right, in year 2000, in this year's, you see the programs and the total in the graph that shows the pension schemes at 6.6%. But this reforms lead us to see what happened with the budgeting. We see what's important, which programs are important to improve the coverage, and our efforts led us to improve the role. We reached almost a 30% of the total pie graph that it's all been added, and we see measured what happened with the benefits of the elderly. In recent years, in the past 21 years, we've gone through a lot of effort at a regional scale in each nation to progress and work to improve the scope of the benefits. You saw in the previous slideshow that our efforts are not sufficient to reach the universal coverage that's in the norm, 202 norm. There's 102 agreements or those conventions that are part of that convention. The nations are part of it, and we're still fighting. Which are the instruments and which are the tools that the ILO has? It's for governments, employers, and stakeholders to improve the scope of our initiatives. The norm that protects our population, it's the norm 102 norm about Social Security, or the other agreement that with its recommendation that's from 1944 about Social Security and means, and then the other, recommendation is 69.
Más allá o más arriba del convenio 102, todos aquellos convenios considerados de tercera generación, es decir, convenios que promueven mayores y mejores niveles de protección social en función de algunas ramas de la seguridad social contenidas.
Social Security in the agreement in 102 in that norm is there. For example, Article 121, it's about the benefits of those who provide professional services. The other instrument is 168, as I said at the beginning of this presentation, and that agreement is there. Then we have the other agreement, that's Agreement 183 about protection during maternity leaves. In 2012, we integrate to this matrix of laws the documents which are referenced, like 102 or 121, that protects our population. And the previous panel member mentioned what we're doing to foster Social Security for the majority, to guarantee social protection and health, for it to be a universal service. This is the legal frame. And there's other instruments that correlate as reference as the agreement state. And the agreements are there because those are the laws that we comply with. These are the most important laws and regulations that should give us light to broaden the coverage in each nation or member state. There's the guiding instruments, the principles, the recommendation 202 and agreement 121, and the others are part of our strategy. The ILO focuses on broadening the bidimensional efforts that lead us to broaden the scope of coverage in a vertical line, which correlates. This slide correlates to the previous one, which are the laws and regulations of the ILO to reform or for the pension scheme agreements. And then we have the norms 102, and access to these services are economic needs. It's a social need. We have to work with solidarity to improve what we provide to the collective. So there's ways in which we can budget collectively these efforts. Budgeting these initiatives are not only on the side of the workers as stakeholders, the employers, or government. Who budgets these programs to guarantee the floors of Social Security for protection? There's the agreement. These are the agreements that lead us to collectively broaden the scope for the members that are part of the system. There's a right according to law. It's a very important point that's about in which we analyze the human capital. And we have this premise or this instrument that's part of the agreement 202, which is the right of our people to have enough benefits. And the beneficiaries should know about the service when they're part of the system. When we speak about the public systems and networks, we're aware about the type of benefits that we have a right. We have rights. So we coordinate our system based on the rest of our actions. It depends on what's happening with our accounts. There's expenditure or OPEX, and the responsibility here leads us to speak about accountability, financial accountability, and the need to finance the initiatives and to analyze the use of the budget as part of our system. Our responsibility is to provide Social Security benefits to all. That's a principle, and that's the essence, that's the heart of Agreement 202. We need to guarantee the floors that protect our society, being inclusive, and it's part of the government's responsibility, which is the agenda of pensions regarding politics and pensions amidst the pandemic and understanding the immediate and future effects. There were so many debates when the pandemic started and we faced COVID-19. Each member state in a region had to do the things it had to do in its way. The impact in different nations they're not similar. The impact depends on the characteristics of the country, the macro and microeconomics amidst the pandemic, et cetera, et cetera. But depending on the scope and impact of the crisis, we need to understand that this pandemic impacts our systems in Social Security. We're opening to dialogue, discussing the needs amidst this to improve the pension schemes. It's not just that we work with a traditional Social Security protection. It's the system that must guarantee economic security for the elderly. Amidst a crisis that has no precedent, but it has an impact throughout this whole term, or this year, 2020, 2021, we've been capable of analyzing or visualizing different core issues or problematics that we had not considered prior to the pandemic. We had to go through certain rehearsals in our nations to deal with the budgeting accounts, to overcome the lack of uncertainty, economically speaking, the lack of certainty for the workforce in the labor field, and we analyzed the vulnerability that our workers have suffered along with their families amidst the pandemic. We drafted some initiatives or kicked off some projects to analyze some instruments. There was a specific case. There was a government, discussed certain issues in the Peruvian case before an assembly and a session and took its matters to court to deal with the budgeting issues or funding through, their specific system in which they could use the budget. We want to provide the right level of pensions for the group of elderly. And after lobbying these matters, we reached a consensus. We know that our population deserves an income. And those who don't have a regular income as a part of a pension scheme has led us to try to give security to the elderly in our population. So there's subjects that do contribute or not that contribute, being this contribution mandatory for the pension schemes. So that's an effort that's driven by solidarity by the workers that contribute for their pensions with the right proportions. We need to face together with the systems all the challenges. We know that there's needs, and the needs need to be satisfied by the system after we analyze the income and the rates. There's different options. The subjects can, as volunteers, contribute to the systems, the pension schemes, or have some sort of, activity. The ILO also submitted its recommendations with a model. It's not a unique model. We have a model, but that instrument could be adjusted to the national needs. What we visualize in the spirit of the law leads us to draft policies, which are the bedrock to consolidate and strengthen systems of the right efficacy to aid the elderly. There's a lot of discussion about incomes, basic incomes, and Social Security matters and the thresholds. Or we've discussed the basic income. We know it's important to provide a basic income to all people in our populations, but the elderly need more of this income according to the basic or the principles of Social Security. There's that instrument, the 202 instrument, that's reference, or international agreements that are the documents of reference. We can think about different properties in our fight to develop Social Security and provide the services, being them universal. We guarantee the floors of Social Security depending on the needs, and we guarantee the income for all the people who are over 65. We should implement this, but we need to redefine or define the people in our population who are 65 or older. We need to focus our efforts, and all the workers who are active or inactive as part of the workforce, they could be part of this creation of public policies with an ambitious initiative. So we continue working to achieve the thresholds or floors for Social Security. We're trying to guarantee economic security. We're seeking to achieve coverage for the 65 and older who need universal coverage. They could have access to the benefits. We need to integrate policies with floors. We need to guarantee their income and their access to services and benefits that are essential at a national level. It's possible for us to build the Social Security floors, and in some cases, We work with the systems and finance using budget, taxes, and contributions. I'll just mention the following. On one hand, the Bolivian case is here. They have a universal way of guaranteeing that all the elderly, even if they're part of the system and contribute or not, they have access to this universal benefit. And since it's financed with taxes and contributions, we have that in the Bolivian case. We can also try to foster this initiative to protect our societies. There's other instruments as reference for Social Security that lead us to achieve higher levels of Social Security protection. There's traditional policies for Social Security under that guiding instrument, that's the 202 instrument, and other laws and regulations. In the top case, you see that the floor is built thanks to the participation of the traditional Social Security institutes and the traditional efforts to focus on those people to, there's people that don't receive an income. So the floor in that graph leads us to see what type of income do the elderly have when they're over 65. By tradition, Social Security are there to narrow the gap. Lastly, as in a conclusion, I have this as a conclusion in my graph. All of our participants can analyze these instruments in the slide succinctly. Today, I would like to highlight the following note about pensions and economic security for the elderly in LATAM. There's uncertainty, as we've said. We were talking about this last year at the end of 2020 for the Caribbean region and the south of America. This sheds some light about the current situation amidst the pandemic. Here you're going to see different options and what different nations or member states have done. There's also reforms or amendments taking place that lead us through a decision-making process that lead us to improve the pension system. Thank you very much for inviting me, and thank you for allowing me to share my presentation. Thank you so much. Thank you, Mr. Pablo. So the subjects are fundamental. They give us a full landscape of the problems that have been generated, and it's been very complex. It's not heterogeneous in a region. In Latin America, it's simply not heterogeneous. On the table, we are here discussing the 2030 objectives. The 8th objective of that agenda leads us to generate the dignifying conditions for the workforce, to extrapolate this and see it mirrored in the elderly of our populations, where there's a higher level of participation rates in the age group of 60 and over. We see that those elders don't have the coverage of a minimum income in the scheme. The coverage should be an acceptable coverage. The income is not enough, so they have to receive that assistance and continue working as unregulated subjects under conditions that are precarious. So we share certain ideas here. There's many paths that could lead us to create and develop just societies, just societies for the elderly. When we speak about their work activity or health issues, as you've pinpointed, amidst the pandemic, we've all been impacted facing this challenge together, considering the advance or the progress that we've had in each field. Mr. Pablo Yanez, the floor is yours. He's the commissioner, the Economic Commission for the Americas and the Caribbean. we're working for that universal guarantee to achieve the basics. Mr. Yanez has an admin or an MBA thanks to Mexico's Autonomous University. He's been a keynote speaker in different forums, symposiums in which he's discussed an assessment of poverty, social exclusion, gender perspectives, income, indigenous population rights, among other discussions. He's been a rapporteur of the CEPAL, in which they've discussed the agreements that date back to 2014, and he's also discussed the agenda for sustainable futures. And also, he discussed about the inefficiencies or lack of equality in the future and its sustainability as part of his work that dates back to 2020. He has published different papers about assessment of society, poverty, human rights. He's published in the magazine called Cultural Survival, Nexus, New Society, Acta Sociológica, Citizenship Compass, Economic Political Weekly, and he's also been part of the legislative efforts. Among other institutions, he's worked for the technical magazine of the Federation's auditing body, among other agencies or institutions. Mr. Pablo Yanez, the floor is yours. Well, thank you so much. Once again, I thank you all. I thank this conference, and I thank the commission, and I thank you for the hard work, what you've been doing. I know that as stakeholders, you've been broadening the points which are a matter of debate in our field, which is social security. I thank you for giving me the opportunity to participate with you. I think it's worth our while to acknowledge the effort that each stakeholder has systematically achieved to consolidate debates, open dialogues, and share like the practices. So that path is promising. I know you've selected a promising path. I'd like to begin my participation today by expressing that there is a need to ventilate the conclusions of what the pandemic has revealed when we speak about a regime for well-being. Not only are we facing policy problematics specifically, we're also facing a need to think and rethink and reconsider the well-being regimes that to date have been in effect or are positive law that have, I mean, the situation has also led us to analyze the positive sides and the fractures and the gaps that require a thorough analysis. From the Commission of CEPAL, we analyze historically the structure. Now, along the lines, from the perspective we have at CEPAL, we have drafted a need. We understand that we need to go through a Build Back Better transformation there with a futuristic vision that transforms, that enables participation. We think that the well-being regime requires its transformation, its adjustments, which are very deep indeed. We have submitted certain information amidst COVID-19 and the pandemic. We submitted an initiative that leads us to progress, towards building a regime of well-being where we can articulate a group of pillars. And these pillars or principles will lead us in this effort to make the scope of our initiative universal. It's not just our initiatives should not be commercial, and they should not be gender-based or female gender-based. The services or health services should be universal, education should be universal, and having access to public services. When I say public services, I mean lighting, access to energy, digitalization efforts, etc. We see that we have a need of a regime, a pension regime With that program, we can guarantee to our citizenship a dignified existence of sufficiency. In LATAM, there's social turmoil or its social effervescence considering the pension regimes that exist today. And it would be a mistake for us to think that social issues are finally reaching closure. There's so many instruments or objects open, structurally speaking, to think about individually capitalizing our citizens in the past 3 decades. It's important for us to acknowledge that there's a problem for our population. When we speak about coverage and sufficiency of our coverage, we also discussed the need that we have to create a well-being regime with new pillars. The 2 pillars or backbones are crucial. One is basic income and the benefits or healthcare system services or benefits that were mentioned by Ms. Mendizabal. And if I mention this, we not only need to think about that, we need to think about the incremental developments of the well-being regimes that we have. We need to think about the new social institutions or bodies and the parallel risks and problems that we're going to face with these bodies. Based on this understanding, we need to build that understanding. Dr. Casali mentioned the context of uncertainty that we're facing in an uncertain future, and that future that's no longer what we thought it would be. So there was we had economic networks of safety, and those, what framed them has been eroded, has been affected, has been hurt. So it's relevant for me to talk about economic safety. Now, by the way, if I mention right now BIDESC as my entity of reference and the conceptual instruments of reference, we know that the economic rights are the ones that are least developed. We have more development in the field of culture or society, but we're not as developed in the economic field. I believe now is the right time for us to discuss what we need to discuss, economics under certainty scenarios. And without doubt, a very important point is economic safety. If we think about what's factual, what's material, and we analyze this in our practice, let's think that the pandemic at some point hit our world having a population with a minimum income. We would think about confinement, social distancing, and other activities that we had to take place that would have had to take place would be different now. But there was a sudden loss of income in our population, and as a result of this lack of income, there's an incremental rate in poverty and precarious situations that our societies are living. Let's think out of the box. Let's think about the scope of things. Amidst the pandemic didn't create the problems. It just made them clear and evident and made us see them. There's a well-being regime that we're building, that we've built, and that we have to build in this future. That's part of the context that sets the grounds for us to continue our dialogue today. Let me now mention the following point. As a note, I'll mention the point that we need to discuss. We need to think, is the following statement correct, exact? Should we continue somehow marking like a difference between the schemes that are in which our people or subjects contribute or not in those regimes in CEPAL? We have sat down to debate this theme. It's been said by previous panel members, they mentioned that in other nations, budgeting is tripartite. The contribution pillar has there's this dimension in the contributions, or there's this order, and there's general expenditures of the budget. The expenditure of the budget, taking the budget to execution in what we call today a system of no contribution. It's not that the people are not contributing and are receiving a benefit from heaven. What's happening is that our subjects contribute indirectly through the general tax collection or revenue service. And in our countries, the taxes imposed on what's consumption or commodities are relevant. If you say that a subject or a member of the citizenship is not contributing, is not precise. And on the other hand, if we think about a transference that's not considered by definition a contribution, I mean, there's symbolism in the context. So there's a segment of the population that receives a benefit without having contributed, but they deserve it. But there's other subjects of the population that contribute willingly. So I think right now is a moment to discuss and open room for debate, whether we analyze the subject theoretically speaking or use specific argot or language. I know that by definition we have general contributions or people that are subjects that contribute or don't contribute, but I think that's not the best way to discuss this phenomenon. But these matters are taken to a political stage of debate and lobbying. So I just want to go back to that origin. I think that these core subjects are a matter of debate. If we think about how to separate rigidly the subjects who contribute, there are subjects that contribute and subjects that don't, but that's not clear or near to what happens in reality and what that how that reality impacts our processes. So suppose we, based on assumptions, it's a basic regime.
What we try to do is to address a relevant issue that is related to the high levels of poverty in the population. But beyond that, beyond combating poverty, I'm going to address that later on. So I like to address that, well, basic rent is not the solution, but it's part of the solution, right? By itself, we know that we have addressed this in many debates. It's not the way to address issues. And it's not, let's say, the replacement of the need of having these public services as education and energy and water and many more things. So accordingly, just having this point in common as an emerging proposal, in some cases we call it an emerging right, and this is intended to ensuring also the right to just ensure, let's say, a basic level of life that is, it's always somehow controversial to define what is basic. And also this is related to the perspective of also having this enabling right. What do we mean? Well, we know that as people have, although we know that we have a very specific situation, regardless of the social situation, regardless of the, let's say, privacy or any sort of, let's say, lacks of things, it is quite clear that it allows having, let's say, more intervention in the social life. It allows, of course, it enables. It does not ensure, but it allows also expanding independence and autonomy of people and processes of decision making. So it's not just a matter of, let's say, measuring and doing things, or just combating and also poverty, and also expanding margins of autonomy for people. So as we have more economic autonomy, we are going to be able to just really have this type of personal autonomy. This is a matter where we know that in the feminine movement, oh, we have discussed this a lot. And well, to me, in my mind, this is an element that we also need to take into account as an enabling factor. It's not the same thing just ensuring what is important and not having it like that. I think that it's a very important factor as well. I would like to refer to the case of Mexico. This is a case that it's quite particular that it's very important as well in the context of Latin America, because Mexico has been doing this for these policies of transfers and many more things towards, let's say, the elders. This is a year, like it's a breaking point as well. We know that we have this degree of progressivity that we need to take into account for the following thing. In fact, having a universal fund for the elderly in Mexico, well, we started in Mexico about 20 years ago, I believe, with the current president of the republic, where we had the mayor of Mexico. We had a very modest, I don't know, pension, about $35, 700 pesos 20 years ago. It was universal for all people for Mexico City. So this is a program that later became a demandable program in Mexico, and that had a very important impact in Mexico. A lot of states started to build upon all of this. They started to have many more programs. The federation itself, it built other programs with other characteristics. At times it was more focalized, not only in terms of means and other properties as well. But what I would like to highlight is that this elderly pension fund that was created in Mexico City, well, it's something that is mainly related in terms of, let's say, basic rent. This is something that we're doing in terms of basic rent. This is universal for that group of people. It's not conditioned, it's not subject to other types of, let's say, tests or other types of things that we need to do. It is individual, it is for a lifetime, and then it's demandable. Same characteristics that we see in basic income as a philosophical concept or universal, if you would like to address it that way. So now, Mexico, specifically for friends and colleagues from other countries, has now a universal pension fund for the elderly, as we heard in some in other previous interventions. And now we have a constitutional significance. We have about a 8.2 million persons coverage. And well, we know that the main criticism that we have specifically for this universal pension is related to the fact that the amount is not enough. So, well, we know that this is of about 0.40 of a poverty line. So effectively, whoever gets it decreases its poverty intensity, but not necessarily its incidence as such. Nonetheless, what we are doing and living right now, this is a process of change. As of the next month, we are going to decrease it from, let's say, instead of 65 years old, we know that we have a high number of, let's say, about July, we will have about, let's say, some sort of possibility of having access to the pension fund after 65 years old. And well, probably this is going to also take, let's say, the list of persons to 65 million persons over the next months and years. So what seems to be more relevant is that first, we are increasing this about 15% in our transfer. This means that as of next month, we're going to have 3,100 pesos, which is about $155 every 2 months. That means that we will be talking about 72, 73 reason And now, as for GDP and expenditure, we know that universal pension for the elders, we have about 0.54 of our GDP. So we're talking about a great deal of transfer that is quite meaningful. But the most relevant part here is that, well, this is specific for the next remaining years of this management that finishes in 2024. And this was a promise that the president mentioned. And by the end of our management term, we know that the pension should be 6,000 pesos every 2 months, meaning 3,000 pesos every month. This is about 145 up to $150 in that ballpark. Why? Because this also tackles what we call insufficient funds. If this objective were to be met of having a universal pension fund of 65 years above in 3,000 pesos. So this is the equivalent of what we have in terms of poverty. So this means that at first we should have some sort of significant increase of income poverty, specifically amongst the adult population in the country, because if the line is 3,000 pesos and you get 3,000 pesos, obviously you are in a situation where you are going to be above or very close to the poverty line. In terms of budgetary matters, then the country would go from 0.54 GDP to 1.3 of the GDP. This would be programs of universal pension fund, not only in the country, but in Latin America. This is a little bit similar in terms of what we have. This is very similar to what's going on in the rural areas of Brazil, specifically for continued pension funds, where we established and provided for that pension funds, rural pension funds should not be lower than a minimum wage, when the minimum wage in the case of Brazil was having a significant increase. So what I would like to highlight is that this is just really moving forward very quickly towards a policy of basic security, specifically for the elderly who is 65-year-olds and above. That is somehow just addressing the need of, let's say, addressing this, let's say, humbleness or insufficient pension amount that is now being received. And at first, we would be, let's say, in some years from now, we would be receiving a universal pension that is equivalent or very close to the poverty line of income that we have measured as part of Carnival. Nonetheless, what I'm trying to say here is that the debate on the basic rent in the case of elders in Mexico is now somehow just really facing reality. In Mexico, what we're building is the basic rent of or income of these elders. Probably this is going to have some sort of let's say consequences whenever we address, let's say, what happens with the income that we see in Bolivia and the universal pension of elders in Mexico. So basically, we have a basic universal income for elders in Mexico as of 65 years old, with an increase of the budget that is going to be quite significant. So that is the trend. This is not a theoretical matter. We are facing a process where we are building a new social institution. On the other hand, I wanted to comment that, and going back to the point where economic security, we are protected facing this risk of poverty. economic security also offers very significant economic matters. So I must tell you that I work in the government of Mexico City when we started just putting in place this universal pension. And one of the things that was really surprising and important was that probably the most durable impact of introducing, let's say, a universal pension was not only related to this indicator, the level of income, poverty, access to certain property, and many more things, but let's say this process of really having more social relationships, let's say the process by means of which we know that economic security translated into personal security in a different way of interacting in the family circle, and also having a higher, let's say, propension or more, we were proner to really go to the public space, and we were following a trend where we needed to assume pension as a right and not just as a benefit granted by authorities. And in my mind, that is quite relevant, quite significant. And while we saw a survey on what it meant for adults to get this pension, and it was very interesting to see all of the answers that we got out of that. So one of them was that, let's say, I eat a better way. Another one was I buy things that I was not able to buy. Another one was my family respects me more. Another one was I go out to the street more often. Another one that I think very interesting to study, someone said, or a group of persons said, I started to give back more presents. So being able in this social reciprocity. So accordingly, I feel that we need to just think of building economic security based on this enabling right. On the one hand, it protects poverty, but on the other hand, we also face, let's say, more independent life with more autonomy. And also, it seems to us that introducing this dimension of social subjectivity, of transformation of social relations that are derived from measures that point to social security is key. To summarize, Mexico will have a basic income, a very universal, very soon. Is this good? Yes. Is this enough? No. Obviously, we need a comprehensive policy to access health and also to have property and personal security and to have access to some training and education processes, caring system, redesign of the public space to make sure that people can have a much higher interaction, but this is a step ahead. So I think that this is related to the new debates that we have on the types of regime of well-being we need to have, what are going to be the components, what are the stakeholders, and what are the pillars. Thank you so much. So I think that it is interesting that you put all of this on the table, just addressing all of these matters that really entail ensuring this type of financial security, just like we mentioned this, beyond just having this type of vital needs. This is also related to this social autonomy that we have. And precisely while we have different, let's say, subjects and topics, many times we know that there are some subjects related to family situations, and when we do not have an income, at times we know that adults sometimes in our family contacts, they are not included in decisions because they're out of the labor market, because they do not have any sort of financial contribution, and they stop being the main, let's say, contributors. Another thing that we have put on the table is that it is important to have enough income, but also when it comes to just putting in place affirmative actions, just like you mentioned this many times, they are part of this elder group, and that is a condition that somehow leads them to be subject to other types of discriminations, meaning not being able to be part of this labor market because of a matter of age. They're part of, let's say, indigenous language also speakers, all of these conditions that are somehow related to the fact that all of this somehow leads to discrimination to some extent. So certainly we are now going to get into the Q&A session. Many participants have stated that they are going to have these presentations here. This webinar is now being recorded. It is going to be available in our YouTube channel of the Inter-American Conference of Social Security. About 2 hours after we are done with the seminar, it is going to be available 2 hours after we are done. So another thing that is related to this, we have a question by Leticia Treviño. What happens with an increase of expense pockets after seeing a decrease in these INSABI benefits concerning this, what we call popular security? So we know that this is specifically related to what Dr. Gabriela means. Many times we know that we have access to healthcare services as part of this service range that we could have. So that would be one. Another one for other speakers. Why is it a priority in this context to ensure social security for adults concerning other age groups? What is, say, the fact that why do we first need to somehow serve this population before other populations? So these are two questions. So I do not know if you would like to somehow address them as you participated. First and foremost, I would like to thank you, Leti Treviño. Thank you so much for your question. I'm really pleased to greet you. So I believe that this policy of just really moving, let's say, all of this according to this budget, well, we would get this type of results. On the one hand, we would provide more resources to a group, just like with elders through all of these services and benefits, as Mr. Peña just mentioned. On the other hand, we also have a lack of resources in other departments. So we need to also do all of it. We have more income, but we have other type of out-of-pocket expenses. In the future, what I see and what I've noticed, as Mr. Pablo Yañez is saying, I feel that we need a basic trend. We know that although there is an increase in that pension amount, still I am still concerned about the fact that we are not recognizing the right to a minimum vital income. We already have a group of elders who get a pension from formal work and income from another pension fund that we have. And like I said, this is not really non-contributive. We have indirect contributions. We have paid all types of, let's say, contributions and taxes for that matter. But this leads us to a reality that we have now in mind. Whenever we represent this, let's say, group of persons who are able to give those gifts, this means that the amount that we're paying is also useful not only to meet their needs, they already have their needs met, they can even give away. I have discussed this with a group of close groups. Well, I was with a true nice, well, I saw an elder. I saw a neighbor. What she did is that we were at church. She was sitting next to me, and when we had to make our contributions at church, I just saw her using a 500 peso bill, and I was surprised. So I asked her, do you usually give away this much money? And she said, no, I'm just giving you away because this is I just got my pension fund. So that means that she has even money to spare, right? You have more budget for medicines and many more things. So I think that I really congratulate you all. I would like to greet you for what we're doing, specifically in terms of elders with the funds that we get. Also, I recall a Bolsa Familia in Brazil program where we were talking about how we are empowering the elderly, specifically in their families. We know that Mr. Yanez was talking about this. So just to wrap it up, Mrs. Leti Trevino, according to your question, I think that here what we have to do, if this is going to happen, if we're ever going to have some sort of, let's say, income, we really need to allocate them where they are needed. According to this principle of equality, we need to recognize these differences and meet the needs depending on each and everyone's needs. Thank you. Thank you, doctor. Please go ahead, Mr. Pablo Casali. Thank you.
Entonces me voy a referir a esta pregunta vinculada de por qué las personas mayores y no la infancia, por ejemplo.
Whenever we're talking about, let's say, the elderly, well, what happens in this case is that I feel that international standards are somehow pushing us forward for us to just be able to be more aware of what on the needs of the different groups. And we know that we were mainly focused on how to do things more than really forecasting how to do it, just for us to be able to have a more comprehensive coverage. I would like to also tell you that we have this social protection floor. This is specifically to ensure economic points as well. We know that this is part of what we do. And it's just it's not a matter of what we're trying to do during this pandemic. We know that we have other types of populations that are also, let's say, suffering the consequences of this pandemic as well, just by offering this type of economic point. And also on whether if it's a formal work or not, sometimes the possibilities of also having this type of informal points based on these emergency actions that have forced all families and all workers to just stay at home whenever we are facing this type of matters. We have deepened all of this, specifically in this labor market as well. I absolutely agree with what my colleagues are saying regarding the fact that it's not really a matter of cutting off this source of funds. We know that we have all types of, let's say, labor markets and many more things, but I also have some other examples in terms of non-paid, let's say, work at home or home chores. We know that not necessarily the right of having this type of comprehensive social protection needs to be based in this formal link according to the rights and everything that we have. So this is a fundamental human right. But also we need to take into account the different institutions and models and the funds that we have for us to be able to really achieve our goals that are mainly related to what we have to do, universal coverage and everything that we do. So I do agree with what Pablo is saying. Thank you so much. Thank you, doctor. Now let's get into what Mr. Pablo was trying to share with us. So more than a question, I think that this is a discussion and a very interesting discussion. So I just wanted to share with you that we need to assess what are going to be the implications in terms of pensions. Let's say whenever we make withdrawals from all these accounts that we have seen in the pandemic. So this is a matter. Well, we know that this replacement rate that we have as part of this individual capital is quite low because people somehow was authorized in certain countries. Well, they authorized to give funds. So this in the medium and long run, this is going to also make an impact. There is no question about it. So this also allows us to learn that people who are workers in the formal sector, they are also part of the individual account. all of this is a level of insecurity. Whenever, let's say, something like this happens, whenever family is affected, well, they were really using these accounts that are not really conceived or thought to really address emergencies and contingencies in a long and medium term process. So we had an issue with the pension system in force and the fact that we had to use funds from these accounts for absolutely legitimate accounts. And I think that we need to do all of this because this could be quite significant. We know that ILO has estimated this already, but I believe that this is a key subject that we need to take into account. So also, I feel that we have a debate on what are needs and on whether people are capable of deciding on their needs, and also giving away maybe a very significant point as well. So I feel that for that reason, people also evaluate the capacity of being able to give away gifts, because also having a lack of funds, that is also social humiliation, not being able to play a social role under equal conditions. So accordingly, we know that debates on what are the needs become more relevant as well. So let me give you another interesting example. Part of the funds of people who are elders and who get these funds, they usually spend about, let's say, they spend their funds in pet matters. You can say, oh, well, that's such a waste. It's so, people would say, you know what, I don't like spending money like that. Well, but you know what? Pets are also the companion of other persons. So to that person, that's a key need. It's key for them to have their pets under the best conditions. So I feel that deciding who gets it, who does not get it is quite complicated. And also what is a need, what is not a need, that is also quite complicated. I've always given the example of, well, the example of a lady who is in a middle class neighborhood, let's say Anzures in Mexico City, if you have been here. And when the social worker visited her, she lived with her son in a good house. And she said, honestly, I have it all set up because my son and his wife, they pay for the house and for food and everything. Even if to go to the doctor, they would take me and all of that. So the social worker said, all right, so why do you need a pension? And she said, because I do not have to ask anything from anything. She said, I agreed to do that, but she needed to ask for things. And this is a right that she had for her to be able to work and have her own funds. So the anthropological situation here is something that needs to be incorporated in the analysis of this type of social actions. Thank you.
Sí, muchas gracias. Realmente creo que se han alcanzado los objetivos que tenía este webinar de ser.
So I think that we have already met the objectives of this webinar, and now we are discussing and we are also just doing all of this. And I think that we could just retake all of the conclusions that we had. All of this is part of the pension that is also insured by the social protection. We need to think of a vital income that is also allowing us to cover needs. If we are referring to an income that is appropriate for the population, whenever we address all of this, because we need a little bit more, let's say, a bigger boost for us to be able to also somehow expand this poverty line. This is not an isolated subject. This is something that is related to other pillars such as healthcare matters and many more things. And we know that sometimes having healthcare issues, well, would lead or push elders to, and well, for us to be able to do all of this, this needs to be a right that needs to be protected and insured by the state, and most coverage and many more things. So we need to also talk about a human right with all people, regardless of the labor condition that people had throughout their lives. And simply, well, I agree with the concept that not talking about, let's say, contributions. These are direct or indirect contributions. Somehow, these are going toward the same, let's say, fund of this income. And another thing that we need to take into account as part of this pandemic is that if we would have faced it with higher level of social security, we are certain that the effects or impact from this pandemic would be much more, let's say, better. So I would like to thank you and pass the floor to Mr. Delin for him to close up this event formally. First and foremost, thank you. Thank you for taking part in this. Thank you so much for being part in all of this. And I think that the most important part is that we need to debate many, many things in Latin America, not only in terms of social security funds and floors. We need to think about public policies and what we address. We are now focusing on, let's say, elders. And like we have heard from our speakers, this from a matter of, let's say, a more comprehensive approach. And how can we just be with them? If there's something that brings us together, is the need. And how are we going to do all of this, taking all of these psychological characteristics into account, political and cultural characteristics of our countries? Just by bearing in mind that this diversity is something that really brings us together and makes us better persons. So thank you so much. This is one of the main work lines that we had in the Inter-American Center of Social Security, and we have been working as part of the conference. We would like to thank all of the speakers. Honestly, we had great experiences. We had very great experiences with a lot of content. And well, right now we would like to ask you to be part of our practice community. What we're trying to do is to bring together a group of experts for them to share these criteria amongst the region for us to be able to have debate as a source of debate. And Mr. Graham, thank you so much for managing and bringing this together. Thank you so much. This is a great investigation team. We have the technical. And those of us who are here, and also we are part. So we have this social security, and also from a point of protection and development, and also just by taking into account, and also because of what we had, this is what really brings us together. And well, that's what we're doing in some other broadcasts on social security. So see you soon. Until next time. Thank you so much. You're very kind. Thank you.